Welcome to the Drilling Millions podcast, presented by Sage Dental Partners.
The last topic I want to talk to you about is cosmetic dentistry. And there's a lot of hype around cosmetics, both from, in the industry and, all over social media, all over Instagram, TikTok, what have you. And I just really want to hone down on how important it is to actually find a niche versus, when you're starting your career, go broad and then sort of narrow down on that niche as you progress.
Yeah, so let's talk about cosmetic dentistry. But before I talk about cosmetic dentistry, I'm going to talk a little bit, and we talked about this when we had our dinner recently, that when I first started practicing and opened my own office around 87, my first goal was really just to learn about how to run a practice, how to manage a practice, learning, and I went to a lot of courses on practice management, hygienists that were maybe, working kind of as practice management consultants, or, doctors that were working a lot as practice management consultants, just learning a lot about how to run a practice. Once I felt that I had that down, then I started to go to cosmetic dentistry courses or restorative courses. And what I originally did was I joined our Toronto Academy of Cosmetic Dentistry years ago. I don't know, this must have been probably, I graduated in 84, I opened the practice in 87. Maybe the first 3 or 4 years, I did a lot of practice management courses, or maybe even the first 5 or 6 years. And then I started going to the TACD courses, and they would have different speakers that came in, i.e. a Frank Spear or a John Coyce, or, prosthodontists, or people who were from the American Academy of Cosmetic Dentistry and lecturing on cosmetic dentistry. And that was my real first exposure. And, it's so easy for, family, like everyone who hangs a shingle is like, family and cosmetic and implant dentistry, or family and cosmetic dentistry. And it's easy to say that you're a cosmetic dentist, but it's true. And we all do resins at the front of the mouth and fixed chips and things like that. And again, we learn like what we're really exposed to in school is so little, right? You might be doing a class 4 incisal restoration or a resin, and you want to do it nicely or perfectly, but what do they really teach you about layering and shading and, like little nuances in school? You don't really learn as much as you start learning when you are actually learning from some of the masters that are out there doing cosmetic dentistry. And I started learning a lot from the American Academy of Cosmetic Dentistry, going to their scientific sessions. And I did that since 1996, pretty much until currently. I still am a member of the AACD. I've probably been to, since 96, 16, in the last 26 years, I probably attended maybe 23 of the meetings, so almost every year I go. And I feel that you do have to commit to education, and doing courses, and sometimes not just 1-day courses, but maybe something that, might be a 3-day course on a weekend. Went to so many courses that Frank Spear did, hotel courses that he did. I did so many courses that Coyce put on, and you're learning from all these things. You're helping to build your confidence in your ability to be able to provide an excellence in diagnostics and cosmetic dentistry and smile design. So there is definitely an art to it. There is a lot of learning to it. There's, the education's invaluable. So I'd encourage everybody to do that. I still continue to learn, and then, after I did a lot of the aesthetics, then I had started learning how to place implants, how to do hard tissue and soft tissue grafting. And then I started incorporating that into my skill set along with the cosmetics. So just gives me a good overview of everything, so that even if sometimes I'm not doing something, but then I'm referring to my oral surgeon or to my periodontist to do certain procedures for me, and then I would be completing them because of the needs of the patient, which are obviously the most important thing. And at the end of the day, I want to just be able to have an excellence in dentistry, an excellent result. So sometimes it has to be multidisciplinary, and you have to work with other professionals to be able to provide the excellence that your patient is seeking. But it's a process, and it's hard work, and it's a lot of learning and a lot of education.
So from being in the space, what is stopping anyone who, as you said, hangs a shingle from calling themselves a cosmetic dentist? Is that just, can anyone call themselves a cosmetic dentist? Do you have to be registered? Do you have to do courses?
Well, I mean, you have a specialty as a prosthodontist, but there is no specialty of cosmetic dentistry. I know the AACD has been long trying to, get some sort of designation for accreditation. And, if you're an accredited dentist of the AACD, it shows that, you've passed certain, criteria in cases. But you can call again, there are accredited dentists, and, many of them will advertise the fact that they're accredited dentists. Some states don't allow that and don't want them to do that. But at the end of the day, it's, people will, if you're doing excellent work, word travels, right? Or you do a lot of, we document all of our cases. When we're doing beautiful aesthetics, we're going to document our cases. We're going to put our before and after pictures up on our Instagram and Facebook and or our website. And, people are going to give us good reviews. So if they're happy with the work we're doing, we've got excellent reviews online. People are seeing the work that we do. Work will come our way. Maybe more than just the person who's just calling them a cosmetic dentist, but really doesn't have the stuff to back what they're saying, Yeah. So at the end of the day, I think the quality of your work will guide you to more success and to get more referrals for the same kind of dentistry.
Right. You made a really interesting point there, and you in a lot of ways followed a very unorthodox path, which is at first you mastered the practice management, and then you started doing implants and cosmetic dentistry. And it's sort of funny when I see people doing it the other way, because if you don't have a practice to stand, what's it going to matter if you know how to place an implant or do any of the cosmetic work? So explain to us the process of why you decided to do that first, because you were probably one of very few.
Yeah. So again, you want your practice to be a success. You want to be profitable. At the end of the day, you can do bread and butter dentistry. You can do fillings and examinations and extractions and, single crowns. And, at the end of the day, you're going to still be successful, or you're still going to be profitable. The only thing is, if that's all I had to do or all I could do in dentistry, I would probably get pretty bored. I've been doing this for 38 years. What keeps my passion? And I do a lot of endo as well. I love doing endo. I just feel very passionate when I have an opportunity to do different things. When my day might have a CERAC restoration or several CERAC restorations, or I'm doing a quadrant of, restorative involving, ceramics, whether I'm doing crowns or CERAC, or if I'm doing endo, or if I'm placing an implant, or I'm doing alloderm grafting, or I'm extracting a tooth and doing alveolar bone regeneration and or grafting, and I'm doing bonding, and I'm doing maybe 4 anterior crowns or 6 veneers. You know, when you've got that kind of variety in your day, it keeps things interesting, you know. And obviously working with a restorative hygienist is great because then I get a chance to get a bit of a break, you know, go do a hygiene check or do a new patient or see an emergency or do a post-operative visit. I just love the variety in my day, you know. And it just keeps things really fresh. It keeps things interesting. Yeah, so that's why I started, you know, doing so much continuing education in aesthetics, implants, and other things, because I had specialists working for me for many years that would place the implants, you know, or would do some of the more advanced procedures, you know. And I said, geez, that sounds like a lot of fun. And I'll be making more money than just doing fillings. And it's interesting. So why can't I learn it?
It's a
And
win-win.
exactly. So I did some soft tissue grafting courses with Pat Allen. And then I did a lot of implant courses with Carl Mish and other implantologists. And then I learned how, you know, I learned how to do a lot. I did a lot of training in orthodontics and Invisalign. And then I started incorporating all those things into my own practice. The Invisalign, you know, the endo, obviously I was doing a lot of because I enjoyed it. And then, you know, to be able to provide the other services, kind of that used to be one of my mottos, kind of all under one roof. Why can't I keep it all under one roof? You know, having all these services. And I know Howard Ferran's really big on that, you know, in his practices, trying to keep everything in-house as much as possible. If and patients love that if they don't have to go somewhere else, and you can, you know, extract their wisdom teeth or do their gum grafts or do their periodontal surgery, and I don't have to refer them out of my office. And I still deal with people outside of my office. Although I have a periodontist, sometimes I still refer to another periodontist. um, and you know, I still, you know, do use my oral surgeon because sometimes he's able to do things under, you know, general anesthetic, you know, or place multiple implants that might involve sinus grafting or more complex stuff, you know, that I want to share responsibility on. You know, for somebody who needs a GA and wants to do it under a general. I deal with specialists still for some things, but there's, you know, probably 90 to 95% of it, I can keep it under my roof, which then makes it more, obviously more profitable for me and also more enjoyable for me
Yeah.
because we're providing a great service, people are happy, and it's a win-win.
Generally, though, how lucrative are cosmetics?
Let's say if I prepared 6 veneers or crowns, you know, at an average of about roughly $1,500 a tooth. You know, and obviously there's a lab cost, but there it might be even greater than that because I might have to replace some of the fillings in it, in those teeth, or, you know, remove previous crowns, you know, etc. But, you know, doing 6 teeth is about a $10,000 case,
Wow.
and you know, lab might be at about $400 to $450 a unit, but the rest is really, you know, your prep time and your insert time. If that whole, I'll easily be able to bill quite well on something like that. And, you know, usually like I'm setting, like I said, an hourly for myself. So I'll probably exceed my hourly when I'm doing major work, like implants or crown and bridge. I'll usually do a little bit better with that. But you know, we don't take shortcuts. You know, I take my time on prepping, I take my time on inserting, you know, it just makes it more enjoyable. Hey, would you rather work on 20 patients who are booked for 20 minutes or 30 minutes each, or one patient for 3.5 to 4 hours where you're preparing, you know, 6 teeth? uh, just makes dentistry more enjoyable. You know, I find it's less stressful to have longer appointments, and you're doing something very fulfilling. And the patients love it when you're able to exceed their expectations and give them really amazing looking teeth and great dentistry. You know, it's definitely satisfying.
And would you say it's the financial aspect that draws people to cosmetic dentistry most of the time, or you think it's just genuine interest in the cosmetics? Because I'll tell you, in ortho or any cosmetic, for example, I just got my eye surgery done, so I get rid of my glasses. And if I had gotten my gallbladder removed or my appendix removed, I wouldn't really care. I wouldn't really thank the surgeon. But after I got my glasses,
Sure.
removed, I gave my surgeon a hug, right? So there's that
Yeah.
component to it too. So it's so much more gratifying, I find.
Yeah. So, I mean, at the end of the day, the doctors who are doing it obviously want to do it because, I mean, let's put it this way. Nobody needs veneers, but people want them. People want plastic surgery. People want facelifts. People want parts of their bodies enhanced. I mean, everyone is into look good, feel good, right? And at the end of the day, doctors want to learn how to be able to deliver, that look good, feel good. So for plastic surgeons, they have all their myriad of procedures for that. And for a cosmetic dentist, we have resin bonding, we have veneers, we have crown and bridge, we have implants, and we have invisible braces and Invisalign. So if you're not going to learn how to do those things, I mean, I would say that probably 1/3, of my income comes from, or maybe even higher, comes from all these services that I've learned to provide, which are adjunctive, which are not necessarily, I mean, nobody needs to do it, but people want to do it. And then they're going to pay more money to do it. They are going to be more lucrative, and that's okay. We're providing a service, and we're and a lot of times I'll just be honest with people. I have so many people who come to me looking for veneers, and I a lot of people I talk out of it. I tell them, but all you need to do is straighten your teeth, do Invisalign, and then maybe you do a little whitening and a little bit of bonding to fix this or that, or you might need to do just a couple of teeth and then straighten your teeth first. So a lot of times I wind up talking people out of doing veneers because it's not the right thing for them. But it brings them to our office. It brings them in for a consult. They talk. And again, at the end of the day, I think people can see when you talk to them and you're coming from a place of caring, and you're coming from a place where you sound like you're knowledgeable, or you know what you're talking about. People can see that, what you're saying is genuine.
Yeah. Well, so selling is a very dirty word in dentistry, right? I think it's shunned upon, at least in dental school, and then by some dentists, they think your job shouldn't involve selling. But Howard Fran, when he came on the podcast, he had said, if you can't convince a patient to get a restoration so that it doesn't lead to a couple $1,000 endo down the road, then you're not even doing your job.
Right. Yeah. So the thing is, again, I think you don't need to sell. I think if you educate, and I think that's what Howard's talking about, is educate your patients, like Mr. Fedevesi, if you're going to basically crown your tooth after a root canal, okay, yes, the crown might cost $1,200, $1,300 or whatever your fee for a crown might be, but an implant's going to be $4,000 to $6,000. And if you lose that tooth or it cracks, we're going to have to extract it. I mean, I'm just educating my patient, if you're trying to do your job, educate them, explain them why it's better to do a smaller cavity than to let it grow or become a bigger cavity or a bigger problem, or a root canal and a large filling. At the end of the day, we're just educating, and then I think the dentistry just sells itself. It just, I don't even consider that I need to sell it. I just talk to my patients once I finish their exams. I sit next to them. I look at their x-rays. I look at their photos, and I'm just talking to them and I'm educating them. And there's no hard sell. And I just tell them, this is what I think you need to do. And this is where you need to start. And it may not be their entire case. It may not be everything that they need to do. If they want that entire overview, I'll give it to them, or I'll book them back for a consult to go over everything. It's just about education, and maybe start off with their chief complaint or what you think is the most important thing that they should do first. And I think, if you're honest with people and educate people, the dentistry just sells itself.
Brilliant. Lovely. So that's the end of the last episode. So thank you so much for coming on the show. It was an absolute pleasure interviewing you.
My pleasure.